Investigates why crash victims might be treated differently at a hospital, even when they have the same health insurance. You can't tell the difference in the emergency room. It happens when the hospital is ready to collect its money. Channel 2's Dave Huddleston is live at Grady Hospital with why some say this is unfair. Dave?
And Jovita, everyone knows Grady provides a critical service here in Atlanta, and they often do so without getting paid. But some attorneys told us that when it comes to a car wreck, some of their clients do not, instead of the hospital going after their health insurance, they go after a cut of some of the settlement. Well, Grady says that is not their policy. We'll tell that to Michael Warner.
When I did come back to conscious, I asked them, did the car roll over? And they told me yes.
Michael Warner was leaving work when another driver slammed into his car. An ambulance rushed him to Grady Memorial Hospital.
We did a CAT scan, x-ray. I think that's about all I can remember. They gave me something for pain.
Despite having health insurance through Kaiser Permanente, Grady hit Warner with a lien on money he'd get from settling with the at-fault driver. That goes against what insurance experts say is the typical route of going to health insurance first.
I told him that I'd use my insurance to cover the accident, and for some reason now I'm stuck with a $17,000 bill from Grady.
Warner's attorney tried to fix the problem, sending a letter to Grady a month after the accident saying, if you fail to bill the health insurance company, you will be in breach of contract. No response from Grady, so a new letter to Grady's hired gun for accident payments, RevClaims, saying health insurance should be billed. In response, RevClaims filed the lien, $17,000, a process typically used only when a patient does not have private health insurance.
Be very trustful of your medical providers, but be very skeptical of anything you're being told when it comes from the billing department.
Attorney Christopher Simon told me he represents more than 30 clients who Grady and RevClaims slapped with liens even though they have insurance. He says hospitals can get full price from lawsuit liens rather than negotiated rates with health insurance companies.
They're only doing it because of greed.
We've repeatedly reached out to RevClaims, located in this nondescript building here in Jackson, Mississippi, to talk about Warner's case or their policy on filing hospital liens, but no one would talk to us. Insurance expert Max Rybold explains third-party companies get a cut of any collection.
So they're definitely motivated, and sometimes they're not the most tolerant of the patient, as it were.
Rybold says Grady treats a lot of patients without ever getting paid.
Perhaps that was the strategically and operationally was their decision was the best course of action to just go immediately to a third party.
We wanted to talk with someone from Grady's leadership team, but they would not go on camera, but sent us a statement that said, at no time over the past year and a half of working with the patient and his attorney were we informed of the Kaiser coverage. This, despite the 2 letters to Grady and RevClaims explaining Warner has health insurance.
And they're a good hospital, you know. I would not want to go anywhere else before Grady, but I wouldn't have thought that this would have come out of this from them. They could do the right thing and just, bill my insurance company, and this could be over.
So, Dave, what has happened with this since you started investigating?
Well, Jovita, after a year and a half of working on this, it wasn't until our involvement that Grady realized there was a problem. They have since released the lien and filed with his health insurance, and they're also sending Michael Warner a letter of apology. Jovita.
All right. You got some resolution, Dave? Thank you.